Welcome back, viewers. Today's topic is the first part of the cancer series, and in this video I will explain what cancer is and how it forms. It is estimated that there are 37 trillion cells in the human body through a process called cell division. These cells grow and multiply to form new cells as the body needs them. When cells grow old or become damaged, they die and new cells take their place. Unfortunately, sometimes this orderly process of cell division breaks down. An abnormal or damaged cell grow and multiply when they shouldn't. These cells may form lumps of tissues known as tumors. These tumors can be non-cancerous, known as benign tumors, or cancerous, known as malignant tumors. Malignant tumors can wreak havoc in the body by spreading into nearby tissues and can even travel to distant places in the body via blood vessels or the lymphatic system to form new malignant tumors. This fatal process is called metastasis. Although benign tumors don't act like malignant tumors, benign tumors are not always innocent and sometimes can cause serious health issues in the body that can be life-threatening. The way cancer cells thrive in the body seems like science fiction. Cancerous cells work as imposter and invade the nearby tissues under the immune system radar. They can hide themselves and deceive immune system to survive. The process of cell division is controlled by the cell cycle control system by instructing the cells to grow and divide and when to die. Cancer cells not only ignore these instructions and carry on with their growth, but also get help from other tissues to thrive. These cancerous cells can cause more than 100 types of cancers. Cancer can develop in almost any part of the body, hence it is named after the part of the body it was initially formed in. I have covered the most common types of cancer spread and cancer mortality globally in the subsequent videos. You might have come across some of the words to describe cancer and wonder what they mean. Words like carcinoma, sarcoma, leukemia, lymphoma, and melanoma. The most common type of cancer is called carcinoma. It is formed by epithelial cells, which are the cells that cover the inside and outside surfaces of the body. Most cancers of the breast, colon, and prostate are adenocarcinomas. Squamous cells line many organs, including the stomach, intestines, lungs, bladder, and kidneys. Some cancers of these organs are associated with squamous cell carcinomas. Transitional epithelium is found in the linings of the bladder, ureters, and parts of the kidneys, etc. Some cancers of the bladder, ureters, and kidneys are transitional cell carcinomas. The other one is sarcomas. Sarcomas are cancers that form in the bones and soft tissues, including muscles, fat, blood vessels, lymph vessels, and fibrous tissues, such as tendons and ligaments. Osteosarcoma is the most common bone cancer. The most common types of soft tissue sarcoma are Kaposi sarcoma, liposarcoma, malignant fibrous histiocytoma. Cancers that begin in the blood forming tissue of the bone marrow are called leukemias. These cancers do not form solid tumors like other cancers. Instead, large numbers of abnormal white blood cells, leukemia cells, and leukemic blast cells build up in the blood and bone marrow. Normal blood cells become unable to perform their normal routine tasks. This can make it harder for the body to get oxygen to its tissues, control bleeding, or fight infections. Lymphoma is a cancer that begins in the lymphocytes, that's T cells or B cells. These are disease-fighting white blood cells that are part of the immune system. In lymphoma, abnormal lymphocytes build up in lymph nodes and lymph vessels, as well as in other organs of the body. There are two main types of lymphoma, Hodgkin lymphoma and non-Hodgkin lymphoma. Then the next one is melanoma. Melanoma is is a cancer that begins in the cells that become melanocytes, which are specialized cells that make melanin, the pigment that gives skin its color. Most melanomas form on the skin, but melanomas can also form in other pigmented tissues such as the eye. Here I am going to show you some figures. The first chart is top female cancer per country. The data is up to 2020. The top of the list is the breast cancer. Out of 185 countries, 159 countries, top of the list is breast cancer. It's most of the Asian continent, Africa, North America, South America, and Oceania. After breast cancer, the second biggest cancer in female is in 23 countries is cervix uteri cancer. Most of the countries are African countries, one country in South America and a couple of countries in Asia. After cervix uteri, liver cancer, lung cancer, and thyroid cancer come at number 3 with one country each. After the cancer cases, let's look at the cancer mortality in female patients. Top of the list again is breast cancer. Out of 185 countries, 110 countries, the top reason of mortality due to cancer is breast cancer. Most of the countries are in Asia, then some countries of North Africa, then few countries in South America. So after breast cancer, the next biggest cause of death in female cancer patients is cervix uteri. Most of the countries are in Africa again for cervix uteri, a couple of countries in South America, and few countries in Asia. Number 3 is lung cancer, the biggest cause of death in female cancer patients. Majority of the North America, European countries, then China, and then Oceania. After lung cancer, liver cancer is the top reason for mortality in female patients in 5 countries. One in Africa, one in South America, and rest is in Asia. Then colorectal cancer again in 5 countries. That is Japan, Asia, some of the countries of Europe. After colorectal cancer, the stomach cancer is top reason for cancer death in 3 countries. One country in South America, and the rest of the 2 countries are in Asia, Bhutan and Tajikistan. Right, let's move on to male cancer rates. The top of the list is prostate cancer. Out of 185 countries, 112 countries, prostate cancer is top cancer in these countries. Is all of North and South America, almost all of the African countries, Oceania, and majority of the European countries. Then the second on the list is the lung cancer. Is majority of the Asian countries, Russia and down the China. After that, some of the North African countries are lung cancer. Number 3 on the list is colorectal cancer, which is mainly in the Middle East and some African countries. After colorectal is liver cancer again. 11 countries is top of the list, where some of the countries in Africa, whereas Mongolia and these countries in Asia. After liver and colorectal, the next one is stomach cancer, which is in 7 countries top of the list. Majority of them are Central Asian countries. After that is lip and oral cavity, which is like mouth, throat, and all that area. Majority in the Indian subcontinent and one of the countries near Australia. Then Kaposi sarcoma, that is in 3 countries is top of the list. Majority are in Africa. Let's move on to female cancer mortality. Again, lung cancer is top of the list. Majority of the countries, North America, South America, Asia, and a couple of North African countries and Oceania, is lung cancer mortality, male lung cancer mortality. Then next is prostate cancer mortality, is the second highest in Africa, then for some reason in Sweden and in South American countries. Then number 3 on the list, out of 185 countries, in 23 countries, the top reason for mortality in male cancer patients is liver cancer. And those are like Mongolia, some of in Africa and other in Asia. Then number 4 is stomach cancer. A couple of countries in South America, one country in Africa, and rest are in Central Asia. Then colorectal cancer, again, the biggest cases and the mortality in male patients in Middle East, as we can see here. Then Kaposi sarcoma cases and also mortality both highest in African countries, as you can see, Malawi, Zambia. Then esophagus cancer, one country in Africa, that is Malawi, and in Asia is Bangladesh. That concludes that. Then finally, we are looking at the comparison chart, which is a comparison between all the continents. We are looking at the population, cancer rate, and mortality rate. If I untick all of them and bring Asia in, as everyone knows, the highest population lives in Asia, which is 59.5%. The cancer rate is 49.26%. And mortality, which is very high, 58%. If we compare this with Europe, the European population is only 9.6%. But if we look at the cases percentage, which is 22.8%, with the mortality 19.63%. Comparison with North America, the population is only 4.7%. But if we look at the cases, which is 13.25%, which is very high as compared to the population, and mortality, which is 7%, which is less than European mortality and obviously Asian mortality. All right. We're comparing with South America, also called Latin America, and Caribbean countries, also called West Indian countries. So the population is 8.4%. which is less than Europe, but the rate is far less. If we are comparing with Europe, is 7.62%, and mortality is 7.16%. Finally, compare with Africa, the population is 17.20% of global population lives in Africa, but the cancer rate is only 5.75%. There might be two reasons. One is that not all the cancer cases have been reported, and secondly, due to their lifestyle, they don't have access to all the chemicals which the Western world have. So for that reason, cancer rates are quite low. But if we compare with mortality, mortality is high as compared to cancer rates. Last but not least is Oceania. The population, world population, 0.50% of world population lives in Oceania. The countries like Australia, New Zealand, and the small islands around them. But the cancer cases are 1.32% of the global cancer rate, and the mortality is 0.70%. So in overall picture, the highest rate is in Asia, population-wise, cancer rates and mortality, but the cancer rate in Europe seems quite high as compared to the population, and similarly in North America. This concludes the first part of the cancer series. I recommend you to watch the rest of the episode on this series, which covers the history of cancer, chemicals responsible in cancer development, and most common cancer types of cancers globally. If you found this video informative, you can share with your family and friends, and you can subscribe to this channel for more informative content. Thanks for watching.